Thank you very much for that introduction. I appreciate that. And welcome to my colleagues and friends and coders and urologists. I'm Dr. Ferragamo. I'm a urologist, and I will be your presenter for today's audio conference. I do hope that you have your handout, as we will be following that as we proceed through the conference. Now, page 1 gives us the title of this presentation. We're going to look at some of the pearls and the pitfalls in urological coding. Now, on the second page, page 2, we're going to look at coding pearls and the pitfalls for transurethral resection of the prostate. Transurethral resection of the prostate, the code 52601, includes the TURP, the vapor and the bipolar button TURP. All of these procedures are billed with the code 52601, and this code has a 90-day global. The ICD-10 diagnoses, which will ensure payment and provide medical necessity for the 52601, is N40.1. That's BPH with obstruction and lower urinary tract symptoms. The second code that will provide medical necessity is C61, which is malignant neoplasm of the prostate gland. Diagnoses such as N32.0 bladder neck contraction, N33.9 urinary retention, R39.12 poor urinary stream, and N39.8 other specific disorders of the urinary system, if used as codes for the diagnostic codes for 52601, you may not be paid with those codes. Now, a TURP can be performed as an inpatient, an outpatient, or in an ambulatory surgical center. A TURP is once in a lifetime procedure, meaning that a patient can only be billed once in his lifetime for a TURP, no matter who does the TURP. Let's go to the third page. Now, when we look at transurethral resection of the prostate in 2006, it may be necessary to get this transurethral resection of the prostate paid. It may be necessary to look at both a primary and a secondary ICD-10 diagnosis. Now, the primary diagnosis required for a TURP, we've just mentioned those, N40.1 and C61, and this coding diagnostic may require a second diagnosis, which may or will be required by some carriers for a TURP reimbursement. If you don't have secondary diagnoses, which would be an additional code or code for associated symptoms, some carriers may not pay you if you do not have this secondary diagnosis for a TURP. Let's look at page 4. Now, before October 1st, 2015, when we billed the code 52601, our ICD-9 diagnosis was usually 600.01 BPH with obstruction and LUTS, and that was all that was required to get reimbursed for the TURP. Now, after October 15, 2015, one billed ICD-10 N40.1, which is BPH with obstruction and LUTS, but we also needed an additional code or codes to be added to the N40.1 or the C61 to be added to ensure payment for the procedure. Some of the ICD-10 codes that were also on the previous page that one may use as second